Hello and good evening. I'm Melisa Idris.
And I'm Sharaad Kuttan.
You're watching Consider This, the show where we want you to consider and then reconsider what you know of the news of the day. As of December 2020, a total of 1,160 prisoners plus 125 prison staff and family members had tested positive for COVID-19 nationwide. Now, by the first week of 2001, new prison clusters sometimes accounted for up to 20% of daily new cases. This raises the issue of prisons and other detention centers as incubators of infectious diseases, particularly COVID-19, highlighting once again that no one is safe until everyone is safe. Over the next 30 minutes, we're going to be looking at whether the urgent matter of decongesting Malaysia's overcrowded prisons through prison reform is ready to be addressed by lawmakers. Our first guest tonight is YB Nurul Izzah Anwar. She's the MP for Pematang Pauh. She's also on the all-party Parliamentary Group Malaysia for the reform of all places of detention, or better known as APPGM. Good evening, Izzah. This bipartisan parliamentary group on prison reform, I'm not going to say its name. It's got a very long name, bit of a mouthful.
Very long.
So I'm just going to call it APPGM. How substantial is the support for the issues that it's championing among other MPs beyond the members of this group? Are you expecting a lot of bipartisan support for it, or are you expecting resistance from other parliamentarians?
I think first and foremost, thank you, Melisa, for bringing light into this important issue. The members of the APPGM are very committed, and we're bipartisan, so that's a good start. And the fact that everyone understands prison health is actually public health, and the fact that we have gone as far as to engage with many stakeholders and brought forward the aim and vision of Malaysia's prison department themselves to initiate reforms is crucial. We also had a good engagement session with the Minister of Home Affairs prior to, I think this was the second last day of Parliament, and everyone in attendance, including the Speaker of Dewan Rakyat and Dewan Negara, were in agreement that overcrowding is an issue leading to Malaysia's prisons being hotbeds of infections. Whether it's scabies, TB, and now COVID-19, we all have to address it. So I believe, yes, we do have sufficient support. What we need is political will to immediately address this issue.
Hey, Izzah, why didn't reform happen during the 22 months of the Pakatan Harapan government?
Why didn't, you said?
Yeah, why didn't it happen?
I think, to be fair to the Prison Department of Malaysia, they themselves had this blueprint of releasing up to 75% of eligible non-violent criminals. So what was required was really the actions of those in power, the minister in charge, and at the time, of course, the Minister of Home Affairs, who's the current Prime Minister today. But I would give credit to the late Minister Datuk V.K. Liew, who was very committed, who was very sincere in engaging not just with us, but Prof. Adiba, the Secretariat supporting APPGM, which is Ceria University Malaya. But again, at the end of the day, as you rightly pointed out, support notwithstanding, you need to release the 11,000 eligible prisoners today, because as you can see, clusters from prison have emerged and they are infecting those in the community.
Right.
So yeah, that would be my comment.
So if I may ask, I've looked at some of the numbers, and in terms of how overcrowded prisons are, there are a couple of different statistics out there. The one that I saw was 44%, and it goes much higher. There's a range. So when you say looking at releasing the 11,000 eligible prisoners today, how far would that go in addressing the overcrowding in prisons? Just how overcrowded are our prisons at the moment?
So I'm going to refer to the data which we received, not just from the prison department themselves, but also the director of prisons policy of the Prime Minister's department. We have a capacity to fill up 52,000 prisoners, but at this moment, as of November 2020, not taking into account those detained under remand, we have 62,000 people in prison. So talking about 10K plus or minus, with 6,470 confirmed total cases of COVID-19. So for me, clearly there's overcrowding, but what's more concerning is the announcement by the Minister of Defence taking into consideration putting more people in prison because they're flouting or breaking the MCO rules that have been introduced. So I don't think the realization has to hit. You have to take a systemic approach to this. We clearly have overcrowding, and if we delay further, more people will be infected, and lives are at stake.
Izzah, it seems that the last year, many social and political issues have been cast in terms of the fight against the COVID pandemic. But surely the issue of prison reform goes beyond the issue of disease or whether prisons and places of detention can become reservoirs of infection. About prison reform, does it extend beyond the question of disease control and decongestion?
Well, it is good that in a way there's a degree of realization, post-pandemic. You understand when we keep saying that prison health is public health, because it's really linked. But as you rightly pointed out, the issue of rehabilitation, the issue of providing second chances to people is really in line with the prison department's own raison d'etre. The motto is basically spearheading corrective services. So for those who enter prison, Malaysia is the country with the best recidivism rate in the whole of Asia, meaning people who commit crime and they actually perform community-based rehab, they don't go and repeat that crime. 99% of them actually are able to turn a new leaf. So for me, that is a testament to how crucial these institutions are to restore, for restorative justice, and to ensure people can live a life that's meaningful. Because like it or not, there are many elements and reasons to why a crime is committed, especially when 55% of those in prison in Malaysia are there due to drug-related crimes.
Right. And I know you've spoken about decriminalizing drug use or looking at it from a different point of view rather than just a criminal aspect. But I wanted to ask about prison reform and the steps we can take beyond just looking at the prison department's early release program to address COVID-19 and the conditions within prisons and detention centers. But when it comes to prison reform, what is it that we actually need? What kind of programs are we looking at? Because it ranges everything from sentencing to detention to post-release programs. Are you looking at the entire chain, or is there one step that you think is easier to tackle than others?
Melissa, you're absolutely right. You need to look at the entire flowchart, the entire holistic plan for reform. And the prison department has actually prepared the blueprint. But despite these pronouncements and plans of releasing thousands of prisoners, to date, the APPGM is informed only 500 have been released. That's hardly sufficient, one. And secondly, in our interaction with the Home Minister, he stated there were plans, in the works to reform and introduce a new drug substance act, a new law to govern and to ensure the ease of which prisoners and those afflicted can gain access to harm reduction therapy. So for me, the problem is in a climate where we are we are in an emergency. There's the emergency declared. I can't bring this up in Parliament. We're not even sure if we can have sessions because the Attorney General's Chambers hasn't addressed that bit. So we do expect the government of the day having the strong mandate as allowed under an emergency, and we've written to them to this effect to take the necessary steps.
Izzah, sorry to interrupt you, but do you know, have you gotten any response as to why only 500 prisoners have been released instead of the 11,000 earmarked?
Yeah. So Dato' Azalina chairs the APPGM. We've written to the Ministry of Home Affairs, the JKJAV, which is the Committee Managing Vaccine and Procurement, and the distribution. And, to date, we've gotten a response from the JKJAV under Mosti, Minister Khairi, and they have actually taken up our suggestion to include prisoners and wardens to be included in the frontliner category. Yeah? So they'll get the vaccines earlier. But other than that, no, we haven't gotten any other responses. We've just recently sent a letter to the King because I believe this is an important issue. And furthermore, with the powers accorded to the executive under the emergency, we need to hold them accountable and to move faster using this powers responsibly.
Izzah, say faster. I mean, right, Izzah, a year ago, countries around the world released prisoners in the thousands. They did it fast. I'm not quite sure. I mean, perhaps you can help enlighten us. Why do the wheels of change move so very slowly in Malaysia, even in an emergency, even with the utmost importance and, and standards being set around the globe? We go very slowly. Why is that?
I mean, Sharaad, it's an important question, and it's something that all of us have to ask. Time and tide wait for no man, and because we're talking about, as you stated, tens of thousands, and they've been released everywhere. Name it, Indonesia, I think Turkey, America, and it's not like we're doing something alien to what the prison department wants. Like every there's a meeting of minds. So I'm really, really expecting through media awareness, through the public realization, not just that release should have happened and taken place yesterday, but no more action should be taken for those who flout MCO rules. I mean, of course, you can fine them, fine, and you should take action regardless of their station and position in life, but if you place more in prison, what's going to happen? You're not going to solve the problem. So it's something that has to include the cooperation and action of all ministries. And I hope, maybe through tonight, APPGM will not give up. I think if we can come together from all parties, agree to this common cause, I don't see why the government can't act today. So I'm still hopeful because, we have to keep up some degree of optimism. But yes, we're losing a lot of ground.
Right. Well, thank you so much for joining us on the show tonight and sharing your insights on this matter. Izzah, we really do appreciate your time. We're going to take a quick break here on Consider This, but after the break, we're going to speak to another member of APPGM and this time look at what legal reforms are needed to address overcrowding in prisons. Stay tuned to Consider This. Hi, you're watching Consider This. I'm Melisa Idris. With me is Sharaad Kuttan. Let's continue our look at addressing the overcrowding in prisons and other detention centres, which have become fertile breeding grounds for the spread of COVID-19. But also, in general, we want to take a look at what is needed for overall prison reform. Joining us on the line now, we have lawyer Sangeet. She's also a member of the all-party Parliamentary Group Malaysia for the Reform of All Places of Detention, APPGM for short, which is much easier to say than the entire name of the group. So good evening, Sangeet. Thank you so much for joining us on the show. Maybe you can
Hi, Melisa.
help us look at the broad picture of what legal reforms are needed when it comes to addressing systemic overcrowding in our prisons.
Hi, Melisa. Hi, Sharaad. Thank you for having me. I think one of the first things to look at in terms of our overcrowding is really the root cause for overcrowding in this country. You may know currently prisons are running at 122, up to 200% overcapacity. And of that, 60% are actually minor drug users. So 60% of that overcrowded prison comes from minor drug users. And I think even from a legal perspective, it is necessary and it is time for us to shift towards a more rehabilitative system rather than just incarceration, because that doesn't address the issue of drug use in this country, which is ultimately the largest component in prisons at the moment. Essentially, to address that, you would be looking at an entire drug policy reform. And that must obviously translate into legislation. Currently, our drug laws for possession, for use, it sends you straight into prison, and that is not the answer.
Sangeet, if I could just jump in here, somewhere late in 2019, the then Deputy Home Minister, Dato' Muhammad Aziz Jamman, said that, maybe we should consider private prisons. And I wonder how, no longer the Deputy Home Minister, but I wonder how popular that idea is. If current prisons can't cope with the numbers, why not build more prisons and actually turn it into a business?
Personally, I'm totally against that idea. We want to reduce prisons in any community. If we reduce the number of people going into prisons, we ultimately have safer streets because people are not engaging in crime. I think we need to understand the root cause of crime rather than just shutting them away. And if you do turn it into a business, ultimately you want that business to thrive and you want your prisons to be full. And that is completely against policy of crime prevention, I feel.
Right. Okay. Well, if we were to come back to looking at the overcrowding in prison, I'm wondering, right now at the moment, do we have a system of early release or perhaps even parole? Is there a mechanism in place that allows for some of these non-violent crimes to be released early, to have other avenues of rehabilitation rather than just incarceration?
Yes, in our Prisons Act at the moment, we do have options such as early release, such as parole board. So these are options for people who have already been sentenced by court to later on be considered, if they are eligible, for early release, essentially. This becomes more of an administrative prison duty, wherein the prison will set up, where parole is concerned, there is a parole board to consider who are eligible. There are certain categories of offenders who are not eligible, for example, firearms, crimes involving firearms, certain drug-related offences, trafficking, things like that, and certain offences in the penal code. But essentially, minor offences, those coming up to about 1 year imprisonment, are all open and eligible for early release and also parole. So these are processes already available within our current system.
Right.
Sangeet,
sorry to interrupt, Sharaad. I just want to follow up on the parole system. I know we have a system in place, but through your observations, are they effective systems? Do these systems work, targeting the right people?
No, I feel that there are bottlenecks, and I think the prison really needs help. I think the prisons themselves acknowledge that they are, well overcrowded, and I think they could use the help. And that would involve a network of government agencies stepping in to ensure that reintegration into community, which is an essential element of crime prevention, it becomes part of this consideration. So I feel that one of the considerations for the parole board, for example, is to consider whether or not this particular detainee will have a place to go to, will have employment prospects, will have a family to go to, will have a roof over his head. All of these things are very, very important considerations, and it cannot all be on the prisons to go through this system. And that's why it is so important to have a network in place to ensure that there is reintegration policies in place.
Sangeet, how transparent is the governance of our prisons? And I remember over 20 years ago, the New Straits Times actually broke a story, a real scandal involving the Tahanan Limpa Sultan cases, basically juveniles held at the pleasure of His Majesty. And the Pardons Board, I believe, was one of the things that was not working. And so these juveniles were spending much more time in prisons for capital cases, whereas the adult who was tried with them was released. Today, are there scandals? Are there things that are absolutely not working in terms of governance in our prison system?
Absolutely, there are still. And pardons, the Pardons Board is quite different from the early release and parole that I just mentioned. The Pardons Board relates to the Agong's discretion to grant pardon. That system is really is not very transparent at all. We do not, there's no fixed system. There is no fixed timing for the sittings of the board. Certainly their meetings are secret, so you could end up waiting years and years and years for your pardon to be considered. So that in itself, to me, is rather ineffective, and there is no real system towards it.
Right. Sangeet, you mentioned, one of the things we need to look at when it comes to prison reform is to look at drug law reform. And I'm guessing that's something that won't happen overnight. But what would you say would be the role of, say, the court's discretion when it comes to preventing more overcrowding, particularly during this time?
Well, I think what I've noticed is that there is no real communication, or these agencies, the judiciary, the prisons, they don't work together. So you have situations where the prisons are totally overcrowded, and yet the courts are just sending people into prisons. And I understand that the prisons are themselves stuck with this, especially now during the MCO's periods. I really think that prison should not be considered as an option. I understand that we need people to be deterred from breaking MCO provisions, but prison is not the answer, and neither are fines to a certain extent. And if fines are to be considered, then perhaps longer periods to repay fines also should be considered, because people don't have jobs at the moment. So paying fines is not really an option. And when they don't pay fines, they go straight back into prison. So it essentially comes back to the same thing. So I think it's so important for the judiciary also to be engaged and to work within existing provisions. There are provisions for community service and other methods of dealing with offenders, particularly those in the minor offences categories.
Sangeet, to what extent do these institutional attitudes reflect larger cultural and social ones about crime and criminals and what justice might look like, and the place of compassion in our society, and so on and so forth? The need to be strict and unyielding, as a sign of strength. To what extent does your grouping have to address these larger cultural and social attitudes in order for this to actually win broad support?
It is it is a cultural issue in that we associate incarceration with public safety. We don't want to be seen to be soft on crime, and I accept that to a certain extent. But incarceration has not translated into a reduction of crime per se, and there are numerous studies on this. So it is time for the government to understand this and not sympathize with it, but to look at methods that work, because the taxpayers' money is being used to run prisons that clearly do not work. They do not work to reduce crime. So that money really should be diverted towards methods that do work. So instead of I'm not asking them to take a sympathetic approach, because I think perhaps that will require a lot more education. But the idea that science and data has shown us that a scientific response to crime is far more effective than incarceration. So I'm hoping that data will be something that might change the minds of those who are going to be making those decisions.
Sangeet, thank you so much for joining us on the show tonight, shedding some light into this important matter. We really do appreciate your insights. Thank you.
Thank you,
That's
Melisa.
all we have for you. That's all we have for you on this episode of Consider This. Don't forget, you can also get the latest news and updates on COVID-19 vaccines on astroawani.com, also the Astro Awani app. I'm Melisa Idris.
And I'm Sharaad, Kuttan, signing off for the evening.
Thank you so much for watching, and good night.